Hello friends, this is the image showing the CT scan. Here this A picture is the CT scan of the chest which is showing this lesion. You can see that this is arising from the pleura. So this is nodular thickening of pleura which you can see here. So this is irregular nodular pleural thickening that is most commonly associated with pleural effusion. So this is what seen in CT scan, but in this picture you cannot see the pleural effusion, but you can be sure that there is a nodular pleural thickening which is resembling malignant mesothelioma. Whereas this is the picture of coronal CT which is showing the well circumscribed masses which you can see, these masses, which and also you can see metastatic hilar lymphadenopathy are also seen. So this is the picture of malignant mesothelioma. Thank you guys for watching my lecture. Thank you.